think the virus is going to show up tomorrow. You know, like Italy didn't know they were going to find that. They think it's going to be there tomorrow, right? You're an incredibly interconnected world. There was a fantastic paper came out a couple of weeks ago which showed the spread of this virus in China compared with, if I remember correctly, was it the 2009 flu pandemic, which was only 10 years ago. And if I remember correctly, every province with this virus had been hit in 23 days. With just 10 years ago, it took 120 days or something like that for all of the province. So, you know, we're just so much more connected. So you got to think it's going to be here tomorrow. If you don't think that way, you're not going to be ready. So first thing is that mindset shift. And the thing you got to think is, if it hits us, we're going to stop it. You have to think that way. And I keep hearing, you know, this, oh, if it hits us, we just have to accept and you know, it's going to spread. And why? You know, you've lost before you've started. So, you know, there's that mindset shift. The second thing is, if you're planning to be ready, you know you're going to need beds to isolate people. You're going to need to be able to quarantine the really close contacts because we know, you know, 10% of those are going to get disease. So, and we know that they may not even know it at the beginning. So you've got to be able to accommodate those people. You have got to have enough ventilators for the serious cases. You have got to know how you're going to transport people to those places, right? You know, who's going to go talk and try and contact trace? Because that's really hard. So that's, you know, readiness for a rapid response. And but it's, you know, when you break it down, every one of those, super doable, right? The other thing is talk to your population. Folks, we have to be ready as if this hits us tomorrow. So everybody wash your hands all the time, right? Don't make a run on the masks because, you know what, probably doesn't make a difference. Now, that may change over time, but we need them for the response. We need them for the infected areas. You got to get your gear where you need it, right? And you got to get your population. They got to know you're going to take care of them. Otherwise, it's not going to work. It's a huge, big piece. So for me, that would be number 3. You know, and the fourth thing is talk to people who have done it. China have done it, you know, and we're building barriers to the people who know how to do this. That's 4. I'm sure there's more.